Hello and welcome to Nahara Learning on Demand. I am here with our partners at Bene PBF. We are super excited to have them here with us today. We have Jennifer Furman, PharmD. She is the Senior Vice President, Clinical Services. We have Polly Pardo with us, Vice President of Client Services, and Doug Benson, who is the Regional Vice President of Sales. We are super excited to have them with us today. For those who do not know me, my name is Janet Borland, and I am the Association Director for Nahara. And we have been a card presenting us with you today. Sorry, it's been one of those days. And we're going to be speaking with them for about 35 minutes to 45 minutes, and they have some valuable information for you. And they will be also at the annual conference coming up on September 23rd through the 25th. So I encourage you to come visit them, say hello to them. They have some really cool items that they're going to be giving out and some really great information. Once again, we're really excited to have you three with us today, and I'm going to pass it over to Polly.
Thank you, Janet. Hello, everyone. Thank you for joining us. I'm going to go ahead and go off camera and share with you the successful strategies for choosing PBM. And for our overview of our conversation this afternoon, I'm going to share with you items of focus to be successful with service, clinical and financial programs, as well as technology, but most importantly, how to make sure that you secure what you need for your prescription benefit program. So we'll go ahead and get started. When you see the term PBM, it's what is it? What is PBM? What does it stand for? The acronym is Prescription Benefit Manager. And what a prescription drug benefit manager does, and we can go to the next slide so that you all can see what a prescription drug manager does, is they administer the prescription benefit for employers, health plans, government programs, most importantly, the tribal groups. So that's what a prescription benefit manager does, or as we call it in the industry, PBM. You'll hear that a lot. And the areas of the functions that they do perform for you as your partner is claims processing is one, and that's handling the adjudication of the actual claim for the member for the prescription drugs on your behalf in the adjudication process. There are clinical programs that are prepared with oversight by them to make sure that the medication is adherent and the patient and it makes sure that the patient is taking the right drug. There are formulary and rebate management, which would be a list of drugs that they put together of covered medications that ensure they're cost effective as well as clinically effective. But most importantly, they've negotiated so that you can obtain rebates, financial rebates back for the utilization of those drugs. And then the pharmacy network management is making sure, we can go back to the previous slide. The pharmacy benefit network management is going to be your retail pharmacies and being where your members can go to the retail pharmacies. And then most importantly, the cost containment strategy is making sure that we look at the drugs that are being covered with all the different programs to make sure that the patients are getting the lowest net cost medications. We can go ahead and go over to the actual role of the PBM. And the role of the PBM is quite simple. They have at the very top of the chart that you're looking at on the screen is they have call centers member services, web-based tools for the member, everything to bring the member, to get the member communication on the benefit, whether it's call or web. You will also want to make sure that you have your a point of contact, your account management team that's providing you with client meetings, the reporting, and managing your eligibility. The pharmacy network I previously touched on, you want to make sure that the discounts are negotiated so that you get the lowest net cost. Clinical management is so very important because it provides a clinical oversight of all the claims to make sure they're being filled for the appropriate drug. And my business partner, Dr. Jennifer Furman, that we just introduced you to, will be going in further detail on some of the clinical attributes that you'll want to look at when choosing a PBM. Of course, mail and specialty pharmacy are key in addition to the pharmacy network, the retail pharmacies, because you want to make sure that they can have a larger amount, not up to 90 days at your mail pharmacies, as well as your specialty medications are appropriately filled because those are going to be the more expensive medications. And then finally, your rebates, making sure that we are negotiating with the manufacturer on the formulary placement of medications to make sure that you're getting the lowest net cost. Okay. We wanted to add an extremely important component is your member services, because that's really what you're choosing the program for, is to make sure that your members get the service when obtaining their medication or their benefit. And you want to make sure that your member services team is addressing the inquiries when the members call in, so that they're able to handle those questions about the benefit. You want to make sure that they're able to provide claims assistance should they need assistance understanding how a claim paid or how to get a claim paid. The prior authorizations, you want to make sure member services can properly speak to the prior authorization that's needed to be in the system, so that the member can get the medication. It's extremely important for the member to be able to get their medication. The disease management programs are in place because you want your members to be able to manage their chronic diseases. Should there need to be, there's regulatories around appeals and grievances. Should the member need to file an appeal or a grievance, you need to have someone that can support you in handling that, as well as, but most importantly, educate and communicate with the members on exactly how they can understand how their benefit works. And with that being said, I'll hand it over to my partner, Jennifer Furman, to provide you some information on the claims processing.
Thank you, Polly. So one important part of a PBM is being able to process all the claims that are received when the member goes to a pharmacy to obtain a medication. When the pharmacist bills that medication through, that medication goes through hundreds of different edits that make sure it's truly the right drug for that patient. Hundreds of edits are executed in sub-seconds from receipt of that claim, so the pharmacy gets back a response very quickly. When it goes through the order of those verifications, it's looking for, is the person eligible? Is the patient eligible on the date the claim is for? Is the drug covered and under the drug category that the plan and the plan sponsor have agreed should be covered? Is it clinically appropriate, or are there any safety or dosing edits that are of concern? Is there a drug interaction, a high dose, a high level of morphine equivalents, or a high level of Tylenol or acetaminophen? Is it the right drug for the patient's age? It also checks in the second review. It checks their plan design to provide back to the pharmacy the copay, deductibles, and other messages that are important for that claim, whether they be safety or messages to the pharmacy or adjudicating the claim, just processing it and telling the member their copay with or without a deductible. So claims processing is a very important aspect of the PBM service to make sure the claims truly are processing the way your plan design has been set up and members are getting the medications they need when that pharmacy submits that claim through their adjudication program. Next, I'm going to move into talking about the important clinical programs. The clinical programs are all executed during that claims processing system. Clinical solutions are the foundation of what a PBM does. It's there to tailor and make sure that it's the right drug cost, lowest option, and most importantly, it is safe for the member. Member patient safety is the first and foremost thing any PBM should be looking at. They are your second set of eyes beyond the retail pharmacy. They can see all the past claims that a patient has had, other medications they're on. The systems are advanced technology that monitor for drug interactions, contraindications, duplicate therapy, and other safety edits that can prevent harmful medication errors should the patient be utilizing multiple pharmacies or multiple doctors. The patient will receive the safest, most effective therapy by going through the different edits when these claims are billed through a prescription benefit management system. There are different types of drug utilization reviews, which again, drug utilization reviews protect the patient's safety. They can happen right at the point of sale when the pharmacy bills that claim through. Those would be considered concurrent drug utilization reviews. Those are looking right then before you dispense the medication to make sure there's no drug interactions or dosing issues that need to be addressed prior to dispensing. The second type of drug utilization review includes retrospective reviews. Retrospective reviews are done after the claim is processed. It looks at, did that patient get the drug they needed? Is there anything that needs to be adjusted or contact with a prescriber? Obviously, the most important drug utilization reviews are concurrent. We want to make sure that all situations are handled before the patient gets that medication. Other important clinical programs that are imperative to helping control cost and making sure members use medications safely and appropriately are prior authorizations. Prior authorizations are a indication on the plan design that a patient would need to have a review to make sure it truly is the right indication for that member and the drug is being used appropriately for medical necessity and cost effectiveness during the clinical review. The clinical review and prior authorization looks at the member's history, gets a diagnosis from the prescriber, and provides all the information that the provider can provide to make sure the drug is used based on FDA approved indication and is clinically appropriate for that patient. Next, other programs that are imperative to prescription management include fraud, waste, and abuse, making sure you're looking at different areas to detect fraud, waste, or potential misuse of medications, making sure you're monitoring for illegitimate medications, inappropriate medication usage, and obviously to reduce unnecessary costs and improve patient safety. Some other clinical programs include step therapy, which is utilizing a less expensive medication before a more costly treatment, and also looking for different avenues to identify areas of polypharmacy where members may be using multiple medications by a specific member and is often seen with complex and chronic conditions. Part of the job of a PBM and the clinical program is to help to coordinate among multiple providers and reduce unnecessary or inappropriate drug therapy, helping to decrease and eliminate adverse drug reactions. And last and final is specialty drug management. Specialty drugs are high cost, expensive medications to treat complex conditions. This involves making sure that the drug is being used appropriately and safely, as they will go through a prior authorization process. It also helps plan sponsors control their costs by making sure the preferred products are on the formulary, have negotiated rebates, and are in a preferred network, which we are all going to cover in a minute. So offering a specialty pharmacy that really helps support the patient, provides them counseling on appropriate use of those medications, and make sure these high cost medications are used appropriately and at the lowest net cost. The next area that's really important to a prescription benefit manager is the formulary that's in place. The formulary is a list of medications that are preferred under a specific plan. These medications are determined and reviewed by an external group called a pharmacotherapeutics committee. The pharmacotherapeutics committee is an external governing body that reviews all the drugs on a prescription benefit manager's formulary list. They're reviewing them to make sure it's clinically appropriate and safe, and making sure that it comprises enough option and therapeutic options to be able to handle the different situations that could arise for a specific condition. The P&T committee is made up of doctors and pharmacists that are all not employed by the PBM. The formulary drug list is a list of preferred products that can be broken out by brand, generic, and then non-preferred brands. The way that this is determined is clinically, which drug is clinically the best product in that particular therapeutic category, and then what the manufacturers provide on the back end, which we will talk about in a minute, are rebates. It also helps to push members to preferred medication by using different plan design options to incentivize the member to use generic, lower cost medications or preferred brands, which would be the lower cost to the plan sponsor. The advantages of a formulary include the cost management and the overall cost of prescription and making the benefit affordable, access to the patient and making sure they have access to all the necessary medications while managing their out-of-pocket costs and their copay. And it provides guidance, making sure it provides clear guidelines for healthcare professionals to pick a medication that is covered to aid in the treatment of the condition their patient needs. One thing that goes hand in hand with the formulary is rebates. Rebates is a rebate received from the manufacturer for putting a medication in the preferred status on a formulary. The manufacturers use this rebate as a way to get PBMs to put their product as the preferred product and to increase their market share. Rebates can be either retained by the PBM or passed through directly to the client, depending on the client PBM contract. It is one of the areas that you should always look at when choosing a PBM to make sure it is the lowest net cost and how they are handling the rebates and if it is passed through to the client or retained by the PBM. The lowest net cost is mathematically the cost of that medication, the price of that medication at retail, minus any discounts within the network, which we will talk about in a minute, and rebates, which are offered by the drug manufacturer. This approach aims to minimize the overall cost and make sure that the plan is clinically effective, provides lowest cost alternatives, and is least expensive to the plan sponsor. Cost avoidance can also be a great way to help control your prescription costs by members stopping medications that are not necessary and avoiding and eliminating duplicate therapy by intensive clinical programs. you can help also control your prescription drug costs. The last important factor that affects the rebate pricing is your pharmacy network. Every pharmacy is within a pharmacy network. The pharmacy network is a group of pharmacies that the plan and the member have access to use to fill their prescription. You have various options that are available through different PBMs where you can have a broad network which covers all pharmacies, which are approximately 68,000 pharmacies nationwide. Some opportunities and PBMs give you the opportunity to limit or restrict your network to certain pharmacies as a way of cost control. By eliminating one or more pharmacies, you can gain deeper discounts at other retail providers. These are restricted or limited networks and can be utilized in certain situations. And a lot of times you will see them in situations when it comes to specialty pharmacy and limiting the pharmacy that specialty patients utilize. The PBM negotiates rates, terms, and conditions with the pharmacy at the corporate level, or some PBMs can rent a third party network to process their claims and provide the information about the pricing. Every client and every pharmacy chain has different terms and conditions. So it is an area that would impact the pricing of your prescriptions, as every claim will go through a pharmacy network. That will be the discount on the medication that is being provided. And then you will look to be and make sure you have the lowest net cost for the cost of the drug, the network discount, and the rebate. Always looking to be the lowest net cost, which the most important way to find the lowest net cost, obviously, is having the right clinical programs in effect. With that, I'm going to turn it over to my colleague, Doug Benson, to walk you through the other aspects of PBM management.
Thank you, Jen and Polly. When considering a PBM, there's a lot of things you need to account for that Jen has outlined in regards to clinical programs and rebates and such. But some of the things that you might want to also take note of are some of the advances that have happened out there that we want to make sure we're utilizing appropriately. Technology is a big, obviously big in our world these days, and used appropriately can help you manage your operation of your PB or your particular relationship with the PBM. Wanted to touch on a couple of key things in regards to technology. First and foremost is the data analytics that can come with it. PBMs use sophisticated data analytics to do several things. One, monitor medication usage, which is tracking how medications are being used by patients to ensure their adherence and identify any potential misuse. Also, they identify trends, which is very important for you, is to know what's happening within your population so that you can detect the patterns in prescription data that can inform for you for future decisions, such as emerging health issues that you may have in your population. In addition, look to optimize your formulary management. This kind of technology can use insights from data to manage formularies more effectively, ensuring that the most cost-effective and clinically appropriate medications are available to various patients. Very important that we embrace the technology that's out there and use it appropriately. Something else that's out, everybody's using these days is our mobile applications. A sophisticated PBM will have a mobile app that you will be able to use to help members have ease and access to their prescriptions. For example, their prescription information can be obtained from that, which helps them understand what's the details of their prescription, including the dosage amounts and refill status. There's refill reminders that can come through an app. In addition to that, there's also cost savings options that show up in these applications If somebody wants to know if there's a generic available, there's generic alternatives that will show through these discounts and other cost saving issues and measures, making their medications more affordable. So very useful. If you're looking for a PBM, you want to make sure that they've embraced the technology that's out there. In addition to technology, we need to make sure that you're getting appropriate reporting from your PBM. What that means is it is essential that you hold your PBM accountable for ensuring compliance and effective management of your prescription benefits. You can do this through several reports. A few I've highlighted here. One is a utilization report. Provide insights into usage patterns is what these reports give you. They help you identify areas of cost savings for important patient health issues. Another is cost analysis, reports on drug spend and cost trends to more effectively manage your budgets. Adherence reports, track adherence, as Jen mentioned, making sure that people are properly using their program and that they're properly using the medications that have been identified for the most appropriate intervention that they may need. In addition to that, there's formulary management reports. Performance and impact of formulary changes on drug utilization and costs, making sure we're using the right formulary. In addition to that, clinical outcomes. These reports evaluate effectiveness of the clinical programs and interventions, demonstrating their impact on patient health. These are some of the more important things that you want to be looking for when you're selecting a PBM. The last point that we want to touch on today is cost management and transparency within the PBM that you're seeking. You want to make sure that if the pharmacy benefit manager you choose has the appropriate cost containment throughout their program. For example, what PBMs will do for you are negotiate discounts. So you want to make sure PBMs have negotiated the appropriate and good discounts from drug manufacturers to secure rebates and discounts appropriately. These savings are often passed on to the health plan or to the patients, making sure that you get the appropriate discounts. These are ways you can contain your costs. In addition to that, other cost containment issues or things could be utilized as formulary management. By creating and maintaining formularies, PBMs promote the use of cost-effective and clinically effective medications, as Jen just outlined. Utilization management. This is key. PBMs implement strategies like prior authorizations and step therapies to ensure that their patients receive the most appropriate and cost-effective treatments. And last but not least, the pharmacy networks and the clinical programs. Jen outlined the pharmacy networks very well. It's important to have the appropriate network in place for your population. Clinical programs, an often overlooked point. Clinical programs are very important for you to be able to manage your drug costs. Too many people get caught up in the discounts and making sure they get the right discount, but knowing that the programs that are in place are for the benefit of the client, saving them the necessary amounts of money that would be otherwise spent if not properly managed within a program. Last thing is transparency. You want to make sure as you negotiate your contract with the PBM that you have clear pricing structure established. Some PBMs are committed to transparent pricing, where they disclose the actual costs of medications and the rebates received from the manufacturers. You want to know that when you go into negotiation. In addition, contract language is very important, making sure that you're not being misled or taken down a road that would not be beneficial to the program. And lastly, as Jen mentioned, rebate sharing. There are different ways that PBMs can either pass through or share rebates. You want to make sure that that is transparent and you totally understand what you're getting into. At this time, in closing, just like to share a little bit about Benecard. Benecard is a PBM. We are privately owned. We emphasize patient-centered care and cost transparency. As a prescription benefit facilitator is what we call ourselves, because we help you manage your program. We're unique in how we partner with our members. The patient-centric approach is important, cost transparency is important, ethical practices. But most importantly, we have great clinical programs that are unmatched in the industry. And we are owned by a pharmacist. We do not answer to Wall Street. So we know that we have the client's best interest in mind when we make our recommendations. As we've gone through the slides today, I know that there's probably a lot of questions, a lot of things that somebody may want to learn more about a PBM. I am going to be at the conference in just a week or two, short time. Happy to spend some time and go through if you have further questions and details about what we do and what our programs can offer, or just general questions about what a PBM should be offering you. If you'd like to learn more, please stop by. My name is Doug Benson. My contact information is there on the screen for you. You may reach out to me, call me, email me, or see me at the conference. Either way is just fine. I look forward to seeing you all there. Janet?
Thank you, Doug. Thank you, Jennifer, and thank you, Polly. It has been great. Doug, if it's okay with you, do you mind if I just ask a few questions?
I would love that.
Okay, awesome. Great. So what sets Benecard PBF apart from other pharmacy benefit managers?
I think some of the things that we've talked about today, one in particular that really stands out is our clinical programs. As I mentioned in the closing there, we really are different. We really do take great care and time to put together appropriate clinical programs that are going to customize themselves to the individual tribe's needs versus just generic programs that are out there that everybody has. We actually want to implement something that's going to specifically help you and your clients.
Awesome. Excellent. In regards to contracting, how does Benecard PBF respect tribal sovereign nation status?
That is a great question. Thank you for asking that, because that is something that's very important to the Native Nation community. They want to know that they are protected and that their sovereignty is respected. And Benecard is actually something that is something we take great pride in. We make our contracts very favorable and directly with the tribe. We don't interact with any other state agency or jurisdiction, so that they know that this is their program, utilizing our tools to help them better themselves.
Excellent. Thank you. And once again, Doug and his team, they're going to be at the conference in Choctaw, Durant. Stop by. They're going to be at booth 27. So stop by, say hello, ask questions, and also to reach out to Doug. His email is doug.benson@benecardpbf.com. Always available. When I email you, Doug, you always respond quickly. So, Doug, Polly, and Jennifer, thank you so much for joining us today.
Thank you very much. Have a great day.
Thank you.
Thank you, Janet.